Hey there, Christophe from the French Herbal. We're going to talk about a large tree that probably existed back in the time of the dinosaurs. It's believed to be around 150 million years old, and Darwin even referred to it as a living fossil. Let me introduce you to Ginkgo. I'm going to walk you through its properties and its uses. This is a deep dive episode, and I intend to give you everything that I know regarding potential uses of Ginkgo. All references are on my website, along with the transcription of this episode as usual. Now, here is an important point. Some indications of Ginkgo relate to cardiovascular or neurological conditions, and these are medical conditions, right? There can be medication involved, and you need to work with your medical team first and foremost. And while we're on the topic, let me remind you that I'm not a doctor, I'm not a pharmacist, nor a healthcare professional. I'm sharing information that I try to make as practical and useful as possible, but this is not a substitute for medical advice, right? So please check with your doctor based on your specific situation. Okay, let's get started with a bit of botany. Ginkgo is a tree that can grow to a pretty impressive size. It belongs to the Ginkgoaceae family, and this family is pretty special because there's only one genus, Ginkgo, and within that genus, only one species has survived, Ginkgo biloba. So as far as families go, it doesn't get any smaller than that. The tree can reach up to 30 to 40 meters tall, so roughly 100 to 130 feet for the largest specimen. In China and Japan, there are trees estimated to be between 1,000 and 3,500 years old, right? So it can live a very long time. It grows very slowly, so if you plant a small ginkgo in your garden, be patient. Chances are this is not for you. It's for the generations after you. You've probably seen some ginkgos in gardens and in parks. We have quite a few of them in France. It's a really beautiful tree. Its leaf has that characteristic fan shape, often split in the middle into two lobes, which is where the Latin name biloba comes from. Unlike most leaves, it doesn't have a central vein, right? And the leaf is green at first, and then it turns a golden yellow in the fall. The tree is dioecious, which means that each tree is either male or female. The male produces catkins that contain the pollen, and the females carry the ovules that develop into the well-known fruit you might recognize by its smell, right? It looks like a small yellow plum, and it gives off a rather unpleasant odor. Modern uses of ginkgo as a medicinal plant is based on the leaf. You'll often read that it has a long history in Chinese medicine. It's true, but only for the fruit. In Chinese medicine, the fruit was used for lung conditions with abundant mucus production, difficulty breathing, and wheezing. So it could apply to certain forms of asthma, maybe, particularly when heat was involved. It was also used for vaginal discharge, for certain urinary issues. And overall, it has quite an astringent energetic profile, helping to regulate bodily fluids. I'm mentioning this because we will find also this astringent quality in the leaf as well. Now, using the leaf is relatively recent, and it was scientific research, not tradition, that brought ginkgo leaf to the forefront. So today we'll be talking about the leaf, which means that I'll be relying mostly on scientific evidence, not on long-standing traditional use, even though us practitioners have been using ginkgo for quite a few decades now. Ginkgo leaf was eventually added to the Chinese medical pharmacopoeia, but quite recently compared to the fruit. Okay, so when should you harvest the leaves? And I'm not sure there's a clear consensus on that point. I've been told that the ideal time is in the fall just as the leaves begin to turn yellow. And apparently, there's a balance to be reached. Let me explain. Ginkgolides and bilobolides, which are two key constituents, they peak at the end of summer right before the leaf begins to change color, so when it's still green. On the other hand, flavonoids will peak when the leaf turns yellow. So if you harvest right when it just begins to turn, you probably get the best of both worlds, right? If you wait until the leaf is completely yellow and it falls to the ground, the concentration of some constituents will decrease. That being said, I've seen that some companies harvest the leaves while they're still green. So, as always, there are different ways of doing things in different countries. From a constituents perspective, given the sheer number of studies, we have a very clear idea of what ginkgo leaves contains. There are three major classes of constituents. First of all, terpenes, including ginkgolides, which are diterpenes, and bilobolides, which is a sesquiterpene. We have flavonoids, the second class, many of them, and proanthocyanidins, which are what we call condensed tannins. So it's a type of tannin, right? With these three major classes, we can explain just about all of ginkgo's properties. Okay, so let's talk about its medicinal properties. There have been a huge number of studies over the past few decades showing many effects, some confirmed by human clinical trials, others suggested through animal studies. So I have to simplify things, otherwise we'll end up with an endless list of major and minor properties. So I'm just going to focus on the main and most useful properties from my point of view, knowing that this won't be an exhaustive list, right? And I will leave the secondary properties aside. For example, ginkgo may have an interesting antiviral effect. Okay, but is it something unique to ginkgo? No, it's not. We have plenty of natural antivirals, and as far as I know, we have no human studies to back this up yet. Okay, so let's start with ginkgo's first major property, which concerns the brain. There's a condition that we might loosely call cerebral insufficiency. And it's not really an official medical diagnosis, but it's rather a collection of symptoms associated with age-related decline in brain function, right? And we could list things like difficulty concentrating, memory problems, a slower ability to perform mentally challenging tasks like calculation, crossword puzzles, Sudoku, etc., compared to what it used to be, right? Occasional mental confusion, like suddenly not remembering why you're in a particular place or what you were about to do, and a state of anxiety or depression. Of course, all of these could also reflect early stage Alzheimer's disease, which is why it's essential to consult a physician. And we'll come back to Alzheimer's in a few minutes. But here, we're talking about conditions that could be considered normal aging. And normal needs quotation marks, since we now know that premature cellular aging can be caused by many environmental factors, from diet to oxidative stress to pollution, lack of exercise, and more. So what we call normal today is also partly the impact of a more or less toxic environment or lifestyle. Simon Mills and Kerry Bone, who conducted an extensive review on ginkgo, explained that it has a specificity for what they call white matter ischemia in the brain. And let me explain. In the brain, we often talk about gray matter, the place where processing and data storage happens, right? Located in the outer layer of the brain, also called the cortex. But underneath it lies a large amount of white matter, and it makes up nearly half of the brain. This is where all the wiring is located. And here you have the axons of neurons, right? Those long connecting fibers surrounded by white material called myelin. This white matter is highly vulnerable to ischemia, meaning localized blood circulation insufficiency. Under normal conditions, this area is well supplied by small arteries. But studies indicate that ischemia in this region, meaning reduced blood flow, may affect mental function and cognition in a significant way. This ischemia may be caused by advancing age, high blood pressure, or strokes and transient ischemic attacks. Mills and Bone believe that ginkgo can indeed improve this situation. And how does it work? And here I think it's worth pausing for a moment because the diversity of its action is quite remarkable. Focusing just on its effect on arterial circulation, it relaxes vascular walls, so it has a vasodilating effect, allowing the pipes to let more arterial blood through. It blocks the action of platelet activating factor, meaning that it affects platelet behavior and it reduces their tendency to clump together and to form blood clots. So you can picture the blood as having a slightly less reactive texture, right? Less prone to aggregation, if you will. It protects vascular wall from damage. And next, it's a major neuroprotective agent. It protects neurons from various types of damages, and it appears to improve brain plasticity. And these different properties, they guide us through almost all of ginkgo's indications for the brain and the nervous system. Protecting the nervous system, protecting the arterial system, and improving the delivery of nutrients and oxygen to poorly perfused areas. We've had numerous studies on ginkgo's cognitive benefits, and I'm not going to review them all. It would be far too complicated. Instead, let's take one study as an example. It's a Brazilian study from 2003, conducted on about 50 men between 60 and 70 years old, none of whom had neurological or psychiatric disorders. It was a double-blind, placebo-controlled trial over a period of 8 months, so a fairly long treatment duration. At the end of the study, participants underwent a full battery of assessment, cognitive evaluation, blood test, brain imaging, etc. The results, a significant increase in cerebral perfusion, right? So in simple terms, better blood flow to the brain. Next, a reduction in blood viscosity, right? The blood was less thick and circulated more easily. And finally, improved cognitive abilities and better information retention. So to summarize, because this part is important, in older adults who do not have neurological or psychiatric disorders, but who experience age-related cognitive decline, ginkgo appears to improve circulation and brain function. Which leads to the big question, I think, should everyone start taking ginkgo at a certain age? I don't think so. I think it depends on the individual and perhaps their family risk factors. But when needed, ginkgo does seem to be a very good plant to help support the situation. Hey, just a quick pause to let you know you can grab my free ebook on preparing herbal teas for the 4 seasons. It's full of simple recipes and blends you can make with herbs you can buy or even grow almost anywhere. The link is right below this episode. Go check it out. This brings us to a question that is very much in the medical domain, right? Could ginkgo help in cases of cerebral insufficiency following a TIA, which is a transient ischemic attack, or maybe following a stroke? The literature is tricky to parse because some studies are solid while others have issues. If ginkgo is compatible with your medication and if your doctor approves and considering its very low rate of adverse effect, I'm inclined to say, why not consider ginkgo, right? I've seen enough positive data in this somewhat complex body of literature to feel that it would probably be a shame to overlook it, right? In any case, this indication is clearly listed in major reference books, both in English language sources like Mills and Bone, and in French sources such as the reference book from Raynaud, a physician. But again, I'll repeat myself. This is a decision that must be made with your doctor. Naturally, if there is poor circulation in the brain, the auditory and the visual systems may not be functioning properly. In the ear, this can manifest as vertigo or tinnitus. Why vertigo? Because in the inner ear, we have a system called the vestibular system. It's made up of semicircular canals positioned along the three main spatial planes, right? Allowing us to detect rotational movement and head acceleration. It's a very complicated system, and if it's poorly supplied, poorly perfused with blood, again, recurring theme, then it cannot do its job properly. So for someone suffering from vertigo or tinnitus with suspected poor cerebral circulation as a cause, then it could be worthwhile to try Ginkgo to see whether it improves the situation. We have a 2011 review on the effectiveness of Ginkgo for tinnitus. The authors excluded all studies that used underdosed Ginkgo extract and that had treatment duration that were too short, like 2 weeks or less. And in this review, 3 clinical trials demonstrated evidence of effectiveness when tinnitus was the primary symptom. And we had 5 clinical trials that demonstrated effectiveness when tinnitus was secondary to cognitive decline or even dementia. Across all of these studies, the perceived loudness of tinnitus decreased by anywhere from 2 to 3 up to 8 decibels, which is quite significant. From a vision standpoint, Ginkgo is used for retinal problems of ischemic origin. In other words, situations where the retina is suffering because of a reduced blood flow and oxygen supply, leading to a diminished visual acuity. Of course, this falls under medical conditions again. But Ginkgo is thought to offer potential support here. We have a review of studies on the impact of Ginkgo on the progression of AMD, age-related macular degeneration. The amount of data is not satisfactory, and the study sizes are relatively small, but we do have at least 2 clinical trials, one in France, one in Germany, reporting positive effect on vision with Ginkgo in that context. In the French study, conducted on a small group of 10 people, visual acuity in the Ginkgo group improved from 3.8 over 10 to 6.1 over 10 after 6 months, a gain of 2.3 points out of 10. And in the placebo group, the improvement was only 0.6 points out of 10. Okay, next. For men experiencing erectile dysfunction, once psychological or emotional causes are ruled out, of course, well, let's remember that beyond a certain age, this could be a sign of atherosclerosis, right? What we call the corpora cavernosa, which is located in the penis, is highly vascularized. It requires good arterial circulation and proper vasodilation. If arterial plaque begins to develop, this area may be one of the first places where it becomes noticeable, right? So in men, it's somewhat of a barometer for arterial health. So first of all, see your doctor if you have erectile dysfunction. But depending on the situation and diagnosis, again, assuming psychological, emotional, and hormonal causes have been ruled out, Ginkgo may help. And here we don't have much in the way of studies, maybe 2 or 3 done in rats, but overall it's mostly practitioner experience from around the world that I'm sharing with you. Okay, so now let's move into a more pathological context. Alzheimer's type dementia. Once again, quite a number of studies and review articles. And here we can broaden the scope to include all forms of age-related dementia, early to moderate Alzheimer's disease, Parkinson's disease-related dementia, and vascular dementia. There are many studies on the topic. There is also a lot of variation in the forms of ginkgo used and the treatment duration, and plenty of controversy. You may have seen the articles over the past maybe 10 to 15 years, one positive studies, then another one criticizing ginkgo, then a positive review article, then another review dismantling it. It becomes hard to know what to think, especially since the conclusion of a review depends heavily on which studies are included in the review, right? And some studies are stronger than others, what we call garbage in, garbage out. Honestly, I don't think I'm the right person to settle this mass of contradictory data. I can share my practitioner's perspective. These situations are complex. Medical approval is necessary since medications are often involved. So be careful. There can be interactions. Now, in practice, supporting these conditions take time. And when results do appear, they tend to be modest. But they still make a real difference in the person's quality of life. And especially, in my opinion, in the caregiver's quality of life as well. And often the caregiver is our main point of contact. And they tell us things like, now he can do this or that task that he couldn't do before. Or I feel like she's able to remember more things now. These are modest progresses, but at the same time, when you think about it, it's quite important. Another indication, ginkgo is discussed in the context of peripheral arterial disease affecting the lower limbs. So what is this exactly? It's a narrowing of the arteries and arterioles supplying the legs. Put more simply, the plumbing leading downward is clogged. And note that we're not talking about venous return issues here, but arterial supply problems, the inability to send arterial blood to the extremities. And doctors will sometimes measure blood pressure at the ankle using a Doppler device and compare it to the standard arm cuff measurement to calculate what's called the ankle brachial index. If the pressure at the ankle is too low, that's not a good sign. What are the causes? Well, generally, once again, atherosclerosis, arterial plaque obstructing circulation. All these small structures, they need to remain soft and elastic, but instead they stiffen and clog. Why? Well, the usual suspects: hypertension causing micro damage to the arterial endothelium, metabolic disorders like diabetes, smoking, other lifestyle imbalances that create a pro-inflammatory, pro-oxidative environment. This promotes LDL oxidation and triggers the formation of plaque, a process that is now well understood and described. Symptoms typically include pain, cramps, or a sensation of fatigue in the legs when walking or exercising. And in advanced cases, there can be pain even at rest. It can be cold legs, numbness, loss of sensation. There could be wounds that heal poorly. And here, ginkgo supports better arterial circulation and it decreases lipid peroxidation, and therefore it may help to stabilize the situation, at least partially. Dr. Éric Laurin on the French side mentions ginkgo for stage 2 peripheral arterial disease, meaning early stage symptoms like pain and cramping, but not yet in the advanced stages of pain at rest or, necrosis, which are stage 3 and 4. All of this, of course, must be evaluated with your doctor. Okay, we talked about the arterial plumbing. Now let's talk about the venous plumbing, venous return. Ginkgo is a classic plant for venous insufficiency and hemorrhoids. It can be quite effective if the situation is still manageable with herbs. And here we help to stabilize things through anti-inflammatory and antioxidant effect. We also decrease capillary permeability and fluid leakage into tissues. We increase venous tone with the tannins, and we protect connective tissues by inhibiting enzymes that will break down collagen. So it acts quite broadly through multiple constituents, the terpenes, the flavonoids, the proanthocyanidins. Excellent plant for these situations. We also have good feedback on ginkgo for altitude sickness and altitude-related symptoms. When we ascend to higher altitudes, oxygen becomes scarce. The body will adapt by producing more red blood cells, but that takes several days. Meanwhile, we breathe faster and the heart beats faster to try to keep up, right? To deliver more oxygen to the brain and the cells despite the lower oxygen level. And here, ginkgo may help to promote better microcirculation and better oxygenation, and it can ease certain symptoms like headaches through its anti-inflammatory action on the brain. We have a Chilean study from 2007 conducted at 3,700 meters of altitude that confirms that effect, right? Of course, we're assuming a completely benign situation here, not cases involving cerebral or pulmonary edema. Next, it won't surprise you to hear that ginkgo can help with Raynaud's phenomenon, a circulation issue in the small blood vessels of the extremities, mainly the hands, sometimes the feet. It's a temporary vasoconstriction that deprives the extremities of blood, and it's weird to see. I mean, parts of the fingers turn white, sensation is lost, and fingers are cold, and then circulation and warmth will return after a while and sometimes painfully. I previously mentioned beet juice for Raynaud's. I'll include a link in the article associated with this episode to remind you of the review I did on beet juice. Well, now you can add ginkgo to the list. It helps to rebalance this overly reactive neurovascular response, and it helps the arterioles to dilate more effectively. We have a randomized control study from 2002 that lasted 10 weeks. Before taking ginkgo, the average number of attacks per week was 13.2, and after taking ginkgo, it dropped to 5.8, which is a 56% reduction, while in the placebo group, we saw a 27% reduction, giving ginkgo a net benefit of about 20%, right? This is significant both statistically and clinically as well. For allergies, ginkgo is considered an interesting addition to herbal programs, and it seems to help with different respiratory conditions like asthma, chronic bronchitis, or even COPD. The benefits appear to come from its well-known anti-inflammatory and platelet-inhibiting effects, right? Platelets have several roles beyond coagulation. They're highly pro-inflammatory, and they are involved in allergic reaction. They actually help to trigger histamine release from the mast cells. Okay, that's it for properties and indications. Now let's talk about forms and quantities. The recommended daily dose is generally 120 to 240 milligrams of a standardized ginkgo extract containing 24% flavone glycoside and 6% terpene lactones. These are products you'll find widely available on the market. All the labs have more or less aligned with this standardization. You'll sometimes see the designation EGB 761, which is the original preparation created in Germany in the 1980s for this type of extract. And since then, well, most manufacturers have used this well-known EGB 761, right? The standardized products contain only minimal amount of ginkgolic acids, which can be allergenic, so that is good. I don't have effective dosage for teas and tinctures that I can share with you based on my own practice, because for ginkgo, exceptionally, I have relied on those standardized forms. And I'll explain why later. Well, it's mostly to avoid side effects. That said, here are the recommended dosages from Michael Moore on the American side and Eric Laurin on the French side. In general, for all of these products, you'll need fairly long courses of treatment to see results. 2 to 3 months are often recommended. So, dosage from Michael Moore, 30 to 60 drops of the tincture of the leaves up to 3 times per day. The dosage from Eric Laurin, 20 to 40 drops 2 to 3 times per day. Regarding the tea of the leaves, Laurin recommends 2 to 3 teaspoons of the dried leaves per liter of water, 1 cup, 1 to 3 times per day. In terms of contraindications and precautions, ginkgo is contraindicated when taking anticoagulants, although in reality the discussion is a lot more complex because we have contradictory data. At this stage, I'm going to keep it simple. If you're taking anticoagulants, it's best to avoid ginkgo as a precaution. Stop taking ginkgo 5 to 7 days before any surgical procedure. Contraindicated in hemophilia or other blood clotting disorders. Ginkgolic acid can provoke allergic reactions, which is why the standardized tablets, they contain only a minimal amount of ginkgolic acid. They carry far less risk, and this is why I've been using them. This type of reaction is more likely to occur with crude forms like tea, tinctures of capsules of the powdered leaves. Now, ginkgo can sometimes cause a particular type of headache, very characteristic with a band-like sensation across the forehead. I began my practice in the early 2000s at a time when we were experimenting quite a lot with non-standardized forms, tincture of the leaves, infusion of the leaves, capsules of the leaf. And indeed, we saw this type of reaction far more often than with the standardized tablets. Okay, this concludes this extended review of a plant with a very long history on our planet. It is a survivor tree, and perhaps it can share a little of its wisdom with us so that we can grow old and healthy too. Thanks for listening. I'll see you soon for the next episode of The French Herbal.